Good morning, everyone. My topic is Nasopharyngeal Mucormycosis with parapharyngeal involvement, a rare, interesting, and novel entity. The aim was to thoroughly examine and evaluate how a particular patient with nasopharyngeal mucormycosis involving the parapharyngeal space showed symptoms, went through diagnosis, and received treatment. Mucormycosis is a rare but highly fatal fungal infection, and rhinocerebral variety is the most commonly presenting variety, and it is generally seen in diabetes mellitus, neutropenia, lymphopenia, organ transplant, and generally in immunocompromised states. Recently, COVID-19 is one of the most commonly predisposing factors in this type of infection. Nasal cavity and paranasal sinuses are most commonly involved, but isolated involvement of the nasopharynx is almost unheard of. So let's have a further look at this novel manifestation. A 49-year-old female homemaker who was a recently diagnosed case of DM type 2 was referred to the ENT department for difficulty swallowing to both solids and liquids, difficulty speaking, right hemifacial pain with paresis, decreased vision in the right eye, and neck pain. Detailed clinical examination was done and radiological investigations were carried out. In MRI neck with contrast, we can see there is a hemorrhagic collection from skull base to C5 level, which has caused narrowing of the airway. Similarly, in contrast in a CT scan of the neck, there is a narrowing of the airway. And in CECT PNS, we can see that the maxillary sinuses and frontal sinuses are not that involved, which is commonly seen in mucormycosis of the nose and paranasal sinus. On DNE, that is diagnostic nasal endoscopy, we can see there is a bulge in the nasopharynx, and we carried out, we sent a sample to histopathological examination, and we can see friable tissue in the next image. And after debriding the paranasal sinuses and sending a sample for histopathological, from the sinuses we didn't get any positive fungal result, so we sent the sample for RT-PCR. So the result is no previous history of COVID-19 infection. The diagnostic nasal endoscopy of posterior pharyngeal wall showed broad aseparate fungal hyphae. Parapharyngeal space involvement with paralysis of the 9th, 10th, 11th, and 12th nerve was there. The patient was not able to tolerate oral feeds, so we did a feeding jejunostomy, and finally RT-PCR of the tissue sample was positive for mucorales group. I would like to conclude by saying that nasopharyngeal mucormycosis is with parapharyngeal involvement is an extremely rare entity. RT-PCR for mucorales group has got a pivotal role in final diagnosis, and nasal endoscopic examination with an eye on nasopharynx is must to exclude rare possibilities. This case can serve as an excellent academic purpose for us as well as in the future. Thank you. We operated for functional endoscopic sinus surgery, but sinuses we didn't. We just sent tissue from nasopharynx, and sphenoid sinus was a little involved, and then we after the patient starting amphotericin, the patient improved.
She not done anything, just apart from diagnosis?
Nothing, yeah, but
no surgical intervention?
No, sir, not as such.
Any update on follow-up outcome?
Sir, patient, this was done around 3-4 years ago in COVID. The patient, I'm still following up. The patient is completely normal. All the complaints have subsided, sir. While amphotericin was, we are administering amphotericin, that time she had a little raised serum creatinine, but now it is not normal. HbA1c was 18.5 when she was recently diagnosed. That was also unheard of, 18.5. HbA1c, sir.
Have you used liposomal or plain simple?
Liposomal, sir.
Simple amphotericin, which costs 50 rupees. Liposomal costs 1,000.
So, but that time we were getting it from the government during COVID-19.
Because in private now you have to see cost of.
Yes. Okay.
In a ideal protocol, nasopharyngeal mucormycosis, for how many days you used amphotericin, and whether you have additionally used any another antifungal or only monotherapy with amphotericin?
Sir, monotherapy with amphotericin, liposomal amphotericin B, and then the patient was on posaconazole when we discharged the patient. Oral
for how many days?
Sir, 3 months. Posaconazole for 3 months and amphotericin while she was ongoing for 21 days according to per kg body weight.
Thank you. Thank you.
Thank you.
Wait. Stop. I request Dr. Sheshin Khadkikar sir to felicitate. Dr. Shenoy.